Alright, YouTube Nation, this is Dr. Pittman at Vein911 in the Nutty Professor glasses. I don't know how I'm projecting here, but you can't do the best possible sclerotherapy without this device. I've talked about that on earlier videos. But anyway, Miss D here is a lovely registered nurse practitioner, and what we're impressed most about Dee is she's been wearing compression hose for a very long time, and so that's a good thing because she's retarded the progression or slowed the progression of her vein disease. But she had a bunch of varicosities all in this area, I don't know, about a year or so ago, that we essentially eliminated with ultrasound guided foam sclerotherapy. She's got a few strays here and there and smaller spider veins that we're also treating today with spider vein sclerotherapy. The reason I'm pressing on this is if it fills back up, or if it goes away when I press on it, that means it's a vein that, a stray or leftover vein that we need to address. So I'm going to go ahead and put a tiny bit of foam in there. I don't know if you saw, it just went, you know, right through these reticular veins, or these kind of, they're faint, they're difficult to see, but it's like a fishnet stocking network of green veins under the skin. And these are of a size that if we don't get rid of them, these spider veins are not going to go away, because these larger reticular veins under the skin are pretty much feeding these spider veins. And foam, in my opinion, is just an excellent way to address these spider veins. You can see here's a reticular vein coming down like this, and it's like a waterfall. This is where the waterfall begins, and here we want to get rid of that waterfall, and so I'm actually going to directly inject this feeder, because if we don't, I don't know if you can see that, but it disappears before your eyes because we're replacing the blood in that vein with this foam that's going to damage the lining of that vein and make it go away. But so again, what we call preview of coming attractions, that vein is basically gone, at least for a minute or two, and then that vein will get inflamed and be absorbed over time. Smaller veins connect right up with those larger green ones, pretty much proving that connectivity and why we have to get rid of these larger feeder veins, or these smaller ones aren't going to go away. It's like, you know, you might have a big root system under the ground and just a few little shoots, and you can cut the shoots off, but they're coming back. And so that's pretty much the concept here. We've got to get rid of these larger, we've got to do a stump removal. If we don't, those larger, or those spider veins just aren't going away.
Can you talk about the benefits of using foam versus liquid?
Foam is much more powerful than a liquid, because unlike a liquid, foam does not get diluted by the blood itself. It actually pushes the blood out of the way and acts undiluted on the vein wall, and it just takes a half a second for that agent in there to destroy the vein wall. So it just needs to come into contact with it. When you inject a liquid, it gets diluted by the blood, and it doesn't act on the vein wall totally, and it doesn't act as intensely. So that foam just pushes the blood out of the way, acts undiluted, and there's less resistance to foam actually than liquid. So foam travels farther and deeper, and can do a better removal of those roots of the problem. We can also treat spider veins with less sessions, with less needle sticks, more effectively, and so that's what we do here. The vast majority of sclerotherapy, cosmetic sclerotherapy these days, we do with foam. And I told Dee I was going to stay below the knee, but this just is so juicy.
I know.
We've just got to get it,
Make it go.
especially with Victor here. So we're put a tiny little needle in there, and you can see that's what we call an etch-a-sketch, or a preview of coming attraction. So that beautiful skin under there, that's pretty typical. It's just that darn vein. So it's gone for about a minute, and then, you know, I'm going to push that foam through. You saw it, we pushed it through here. I'm going to hit this again, and then it comes back, and it's angry, but that's a good thing. It's mad. This spider vein's been de-shrinned for a very long time. If I had to predict, it's been there since her 20s. And it's just gotten bigger and bigger and bigger, and she's not going to miss it when it's gone. And right now it's angry. It says, you're my friend forever, and you're trying to get rid of me, and I'm going to get pissed off. And so it's mad, and it's red and inflamed. But you see how it was purple before, very friendly being there on her leg, and now it's like, what are you doing to me? And so that's a good thing. We've inflamed the lining of that vein. We don't need to do any more. That foam's very, very powerful stuff, and that's going to look worse before it looks better. Okay, it's been her friend a long time. It's not going to leave easily, so it's going to remind her of Dr. Pittman and Vein911 for a few weeks, and then it will go away. So what I tell our patients, you're not going to like us for a couple weeks, 3 weeks, but after a while you'll like us, and you'll be back. So anyway, let's go back down in here below the leg. This is another feeder vein, and I'm just going to go ahead and get that while we're here, and get this too. Sandra, how much more we got left there? Okay.
Dee, why don't you tell me about your experience before how many, you said you had 3 treatments?
I have had 2 foam therapies last year. And what I liked was that it was relatively, it doesn't hurt, other you feel the needle occasionally, but it's not anything you even feel consistently. The injection you do not feel. It did not interfere with my going to work. You do have to wear support hose when you have the big veins done, like I had done, and you have to be willing to do that for the completion of therapy. That's what I was told, and I've had good results, and I did follow that. And it didn't interfere with work, so you can go to work. It doesn't interfere with life. And I don't have these big ugly veins that look like these on my legs anymore. That's how my legs were everywhere. So I'm delighted. A lot of results with very little discomfort and no interruption of life.
You'd recommend this guy?
I would absolutely. I would, without hesitation, tell you to come to see him.
We have a whole team here, so I don't want to pretend I'm the magic.
Well, it's
but,
his team.
We've got an entire team here, and they're all well trained, and we're about 100% patient satisfaction when we're alcohol.
And if you were wanting to know, would I send? I'm back. So 1 year later, I'm back having more done. So yes, I would send other people.
And I'll come here now. So anyway, like most patients, the average spider vein patient's going to take at least 3 30-minute sessions. And in an average patient, by the 3rd session, we're literally searching for spider veins. Dee's going to need at least 3 sessions, based on what we're seeing here. So we've treated the larger varicose veins, and this is really the first time we're addressing kind of her spider veins and any lingering smaller veins. And we're going to concentrate on the larger spider veins first, and then next session, we'll go to the smaller ones and then the smaller ones, and so that's kind of how it works. It's almost impossible to significantly eliminate spider veins in a single session. If they take, my kind of flippy statement would be, if it takes a lifetime to get there, it's going to take more than 30 minutes to get rid of. So it's a bit of a process, but the treatments these days for medical and cosmetic vein disease are so simple, so easy, literally painless. No one need live with medical or cosmetic vein disease. It's just simple to get rid of these days. Not like the old days, not like even 10, 13 years ago. Treatment's just come a long way.
So if you want to learn more about these or other procedures we offer,
If you want to learn more about visual sclerotherapy with liquid or foam, ultrasound guided endovenous chemical ablation, or what we call ultrasound guided foam sclerotherapy, or endovenous laser therapy of varicose veins, check us out at Vein911.com. Like us at Facebook. Subscribe to us on YouTube. Check us out on Twitter and LinkedIn. Or simply give us a call, 855-VEIN911. We'd be happy to answer your questions. If you have medical or cosmetic vein disease, head to toe, it's what we do at Vein911. We don't do Botox and fillers, we do just veins. If you have a vein issue, think Vein911.